So we have today, we're joined by Kamal Matani, who is Associate Professor and Director of the Evidence-Based Healthcare Leadership Programme. Kamal is a practicing GP in Oxfordshire, and he's also co-director of the Centre for Evidence-Based Medicine here at the university. And I'm sure Kamal wouldn't mind me mentioning that he recently received the RCGP's John Fry Award for promoting the discipline of general practice through research and publishing. And then we have Sean Hogan, who is a chartered organisational psychologist and the senior associate tutor on the evidence-based healthcare leadership programme. Sean has got extensive experience working with both individuals, teams and organisations in the fields of training, coaching, change management, selection and leadership development. And he has worked with a wide collection of companies across multiple sectors in his career. Sean is also an associate fellow of the British Psychological Society. So I will pass on to Sean and Kamal now to take you through the presentation. And then, as I said before, please do submit any questions you have, and I will pick them up for that part of our session. But without further ado, I will invite, I believe, Kamal to take us through the beginning of the slides.
Great, thanks very much, Sam, for that introduction. It's very kind of you. So welcome, everyone. It's a really delight to connect in this way, and I'm looking forward to questions that you may have. So let me tell you a little bit more about the new programme that we're launching. First, let me start by who's it for. So for a number of years, we've been running master's level postgraduate programmes in evidence-based healthcare. And this is a little bit of an extension of that. So this programme in leadership is for clinicians, managers, service providers, research academics, policymakers, people working in data, in health data analysis, journalists, people working in the health industry, and much more. So this really is quite a broad programme, recognising that evidence-based healthcare and the practice of evidence-based healthcare involves a multitude of skills and roles. So this is thinking about what sort of leadership can we bring to those roles. Next slide, please, Sam. So why would you want to come and join us? Let me just take you through 3 points. So by coming and joining the programme, what we'll do is we'll help you start to examine and sort of critically analyse and then refine your own leadership approach to those settings and some of the challenges that you face. We will offer you the opportunity to develop practical tools, techniques, skills to meet some of these challenges and overcome them, whether you're already in a leadership position or you're becoming an emerging leader in your field. And our ultimate goal is to develop evidence-based healthcare leadership capacity and capability that ultimately improves patient outcomes. Next slide, please.
Okay, it's handing over to me. Thank you, Kamal. Hello, my name is Sean. I'm the co-director on the programme and senior tutor at Oxford. Why would you want to come on the programme, and how are we going to run the programme? Well, the programme is comprised of 3 modules. So module 1 is 5 days, running Monday to Friday. Module 2 will be 5 days, running Monday to Friday, and module 3 will run Monday to Thursday. Now, we've designed the programme in such a way that you can study individually as a short course, as well as a complete programme. The complete programme will probably take in the region of 18 months to complete. And what we'd like to do is start off with the initial module 1, looking at people's leadership journey and what they think about leadership, how they themselves are seen as a leader, and what we can do to develop them as a leader.
Thanks, Sam. Next slide, please. So as Sean said, we're going to take you through 3 modules. And the first module is called the Fundamentals of Leadership. And during that module, the theme of this module is really to kind of get to know yourself as a leader. So what's your leadership style? What's your abilities as the leader? How might you apply it to your particular environment? We will touch on key components of leadership theory, but we take a very much applied approach to this understanding. And by that, what I mean is we will look to see how these theories can be used and applied to your personal setting. How might we tailor some of this understanding to something that can help you? We'll also spend time understanding the role of personality. So particularly your own personality and the sort of styles of leadership that comes through understanding a bit more about your personality. And that will be done through various tools, but also through one-to-one coaching as well. Next slide, please, Sam.
Thank you, Kamal. Over to me for module 2, which we've based on organisational leadership. So this is really a key understanding now of the crucial components of what do we mean by organisational leadership, how organisations evolve, the fact that organisations are themselves an organic module, constantly changing, constantly moving, and particularly in a healthcare setting, as well as virtually every other sector of the world that's been affected by COVID. There's been huge organisational change. So we look at the key elements of organisations and how leadership impacts on those key elements. We then look at this whole idea of teams within organisations, how to build successful teams. What are the components of successful teams? We've all worked in teams. How many of those have really been successful teams? So what were the key components and how do successful teams maintain that over a period of time? And then also, we're going to bring in, which Kamal and I are going to touch on a little bit later, people with understanding of groups and organisations from other sectors. So we can learn from what other people do in other sectors and how do we apply that back into healthcare. Next slide, please, Sam.
Thanks, Sean. So as Sean said, so we then move from thinking more about organisations and teams and groups to thinking, going back to you as an individual, having put all those learning from module 1 and 2 together, and then thinking about the next step. You know, what is the next level of strategy that you might need to apply some of this leadership in some of these, you know, very complex environments? So we'll be thinking about using strategy and applying it to the sort of scenarios and environments that we work in evidence-based healthcare. We'll be thinking about the real-world skills that we need to implement to be able to apply and make changes and have influence. And we'll think more about how your leadership profile can grow, both through in your own environment, but even wider through enhanced dissemination, productivity, even working with the media, and all the benefits and challenges that can bring. Thanks. Next slide, please.
Okay, thanks, Kamal. Thanks, Sam. So what are we proposing in terms of training and learning methods? Well, we have been able, because it's Oxford and it's Oxford University, and it's the Centre for Evidence-Based Medicine, and all of the wealth that of talent that is available to Oxford, we are building in lectures from leading experts in their fields around the world. We're proposing masterclass seminars with an emphasis on the real learning and interaction with that person holding a masterclass seminar. Internationally recognised evidence-based healthcare leaders who are available to come along and discuss and talk and pass on their real knowledge and understanding of evidence-based healthcare. We are designing the whole program so it'll be around small groups in what's called action learning sets. So we'll be setting up specific action learning sets with small groups, and we'll also be offering one-to-one coaching. That's available from module 1, but it could also be available if people choose throughout the rest of the program. Thanks, Sam.
So I hope that's been useful to you, just to give you a little bit of an overview. I think Sam's going to just sort of support us in answering any questions or filtering any questions about that. There's lots more, and if you want to find out more about the program, you'll see on the shared screen, there is a dedicated website which goes through some of the things that Sean and I have covered in much more detail. And just to emphasize something that Sean said there, you know, we very much take an approach of ultimately trying to achieve better outcomes for our patients. And by applying those principles of evidence-based medicine, so understanding good research evidence, understanding patient values and our own expertise, and then developing our skills to the next level as leaders of being able to apply them in healthcare settings. So we very much look forward to your questions, and can I hand you back over to Sam now?
Thank you very much, Kamal, and Sean as well. Thank you for that overview of the programme there. I'm happy to say we have got some questions to go through, which I will happy for either of you to pick up as we go along, but please feel free to both contribute. Just a reminder to everybody on the call, if you do have a question, if you could please input that question in the Zoom chat box, send it to me down as the host, Sam. If you send it directly to me as a private message, and I'll pick it up and relay it to Sean and Kamal. Also, if you would like to follow up on that question, have a more in-depth discussion about it, then if you just like to raise your hand, I can unmute you and put you on to discuss. Yeah, we've got, as I say, a few which have come in here. So I have probably the first one, I think. I think someone's picked up with some of the material which has been produced about the programme already. So it says that we've mentioned quite a lot about leadership types and styles. I'm curious to understand how you will help to discover my style and how this can actually help me adapt in my career. So I don't know who would like to, perhaps Sean?
Yes, thank you very much. Thanks for the question. That's the first thing. In terms of understanding leadership styles, one of the things that we were proposing to do in Module 1 is to ask people to complete a psychometric questionnaire. And that will give us some really good information about personality types. It will also give us some really good information about the aspects of leadership that people already display. And we're going to use that with one-to-one coaching in the first session. So we have a specific time set aside in Module 1 for one-to-one coaching. That the coaches we're using, very experienced coaches who are used to working with leaders in a number of different sectors as well as healthcare. And they'll use the information from the psychometric to really dig a little bit deeper into individuals' understanding of themselves as well as their leadership style. So that will be a base then, which we will link in Module 1 to a clear understanding and explanation of the multitude of leadership styles out there. And we'll have a clear explanation of which of those styles will be fit different sectors and different experiences that people have. So we'll bring that together in terms of the fundamentals in Module 1.
Yeah, and if I can just add to that, thanks Sean, is we'll also give you the space and the time, which many of us don't make time to do, to reflect on some of our own characteristics and some of the things that make us as emerging leaders or leaders in ourselves. You know, what are those characteristics, and how often do you spend time thinking about those characteristics and how they can be applied in your setting? So that's the third element, just to give you some protected time to be able to do that.
Great, thank you very much. That's a nice, thorough answer to the question there. Thank you both. We also have, I think, a question here about the modules and the different modules of the program. So it says, would you recommend a particular module for leaders at different stages? So I think different stages in their career or in their particular exploration. That might be if they've taken a previous leadership program. I don't know if be able to have any thoughts on that about. Because obviously, as we've said, that there are the different modules taking place at different times over the 18 months. But what would your feelings be on that, Sean and Kamal?
Yeah, I'm happy to take that question first. Thanks, Sam. It's a good question. The ideal way that we've designed the program is more of a continuous journey. You know, Module 1 feeds into Module 2 and Module 3, and in the way that we've outlined in our presentation. That said, we appreciate that different people will be at different stages in their leadership journey, and we don't want to exclude anyone from joining the program. So for that reason, we've also tried to be smart wherever possible and designed it in a way that people can join at different points in the program. So for example, if you've been through, say, an early leadership program in your career, you've started to understand a bit more about your own style, but you want to know more about organizations, then yeah, we can have a conversation about how Module 2 might best fit your needs. Or you understand that you want to think, right, well, I'm already a leader in my field, but I just want to go that extra level. I want to go to that next level, thinking much more about longer term strategy, developing my profile, managing the different conflicting things that take up my time as a leader in a better way, the productivity element, then maybe Module 3 is the right thing for you. And Sean and I always are very happy to discuss how those modules and the learning might be tailored in a way that suits you best.
Thanks, Kamal. Just to pick up on one point, if I may, I guess in answer to the question that adding to the layer that Kamal has added there, it would be, where are you in terms of your leadership? So are you a newly confirmed leader? Is this something that you've done in depth? Are you looking to develop your career in a certain way? And as Kamal has alluded to, then understanding yourself as a leader would really be module 1. Then organisationally, where is your organisation going? Are you at a point where you are looking to step into perhaps leading an organisation, or that is something that you're looking to do in the next 2, 3, 4 years? Then module 2 would be useful. And strategically, that would be useful if you're looking at how do I plot and plan not only my career, but also perhaps where the organisation needs to develop, particularly with all the challenges we've had recently with COVID.
Great, thank you very much. That's very helpful answer. I hope that answered the question there, and I think it did. It was very thorough. Thank you very much, both of you. Got a slightly longer question here, which is about business schools as well, actually. So I'll just read it. I've been looking at a few short leadership programs, including some at business schools in the US and Canada. What would you say are the differences between your course and one of the more established business school courses?
Yeah, I'm happy to start that answer off. So it's a great question, and very happy to provide an answer to that. So I think there are lots of, there are lots of leadership programs. There are lots of business schools that run leadership programs, even in Oxford, where we work as well. I guess what makes us a bit different is that a lot of those business schools start with thinking about leadership theory in a more broader sense, and then try and fit that towards your context. We flip it around. We understand healthcare. We've been, Centre of Evidence-Based Medicine has been, running for 25 years. We work closely with clinicians and partners through all the sort of specialities I mentioned at the start of the presentation. So we understand healthcare. We understand evidence-based medicine and the challenges of trying to practice that. The next thing we're adding then is, okay, so how can we then develop the capability and skills and leadership to do that really, really well? So we're starting very much from the ground up, patient-based orientated outcomes, evidence-based medicine, the leadership to put that all together. And few of us will argue in healthcare that, that improving patient care isn't the ultimate goal. So we've been guided in designing this program by the same principles that underpin evidence-based medicine: understanding patient needs, developing an understanding of patient values, understanding evidence, as well as your own expertise. And I think as practitioners, we understand the challenges. And as I said during my previous answer, we very much think about this as in a way of applying skills to meet those challenges. And we will develop your skills and qualities as an individual, as I said, as an emerging or future leader, to be able to do that better.
Okay, if I may just add as well, thanks, Kamal. One of the things that we've worked really hard to do in designing the program is also to bring in people with vast experience of leadership. And Kamal and myself have both run teams, we've both run big organizations, we've both run multi-million-pound organizations. So we've been there, we understand some of the practical day-to-day issues and challenges, as Kamal has alluded to, but also we're bringing in people on the program with masterclass experience of running big programs who are happy to share their knowledge of some of the real sort of intangible challenges of day-to-day action-based running with a program. So it's not just the theory, it's very much based, as Kamal has alluded to, in the action.
Great, thank you very much, both of you. That's great. And actually, with the words action in mind, I've got a question here. Potentially two I could combine together, actually, because one is about the action learning groups. So it's asking for, could you provide some more detail about the group learning and action learning sets? How will these work? And then we had another one, which is about how can participants stay in touch between modules? Is this something that you see as being facilitated by the program? So if it's right to conflate those two together about the action learning sets and how they work, and then how potentially these sets, these groups of participants actually stay, or can potentially stay in touch, or be encouraged to stay in touch between the modules.
Yeah, so great question again. Sean and I have designed the program so that there's multiple layers and levels of learning. So as Sean has alluded to, you know, one of those layers will be sort of taught more structured training. Others will be more experiential training. So as Sean said, look, bringing in some existing leaders in evidence-based healthcare and understanding some of the challenges they face and the methods and tools that they've used to overcome them. Then, and the third element is about learning from each other and the opportunity to spend time discussing some of those challenges in a very intimate group, in a protected way, and hearing other people's challenges, discussing your own challenges, and then asking and exploring whether other people have faced those challenges and the sorts of things they've done in a much more detailed, granular way. And we feel, and we've had experience of action learning sets being such powerful tools to be able to enrich the learning within programs like this. So the action learning sets, just as in a more mechanistic way, will be sort of groups of about, let's say, 8, 10, something like that, whereby you'll have some protected time to discuss with each other and facilitated by Sean and myself, some of the challenges you're facing and some of the things that you've thought about to overcome them, or learning from the group about ways to overcome them as well. Sean, I don't know if you wanted to add something to that from your experience with action learning sets as well.
Thank you. Yeah, action learning sets really, as Kamal has alluded to there and already spoken about, really powerful learning, taking a granular level, really deep down level, some of the issues and challenges that people present and come with in terms of how do I actually do this in organizations, and break that down and listen to how other people in your group have actually done that. And not just the theory, but a walk through of how people have actually put into action some of the changes that we're going to talk about on the program, and they're going to possibly be needed either in your career or in your organization.
Yeah, and then thanks, Sean. And then in answer to that final second part of that question is, yes, we do very much encourage participants to stay in touch with each other, and we'll go through some of the ways that can happen and how we might facilitate that, for example. But we do prioritize this as part of the program because the learning shouldn't be just when you come to Oxford and meet Sean and I and the team and the leaders that you're going to meet. It should be beyond that. When you leave Oxford, it should be the continued learning process from each other through those action learning sets. And we will go through the mechanisms of how we will facilitate that taking place.
Thank you both very much. That's great. I have one more question about the sort of the logistical side, I suppose, of the programme. Just to mention as well that if there are more in-depth logistical questions about ways to join and any other specific questions, then we have a lot of information on the website on the link which is provided here, but also I'll be providing some links for getting in touch with our team directly, so we can feed that back to you and continue that conversation offline. It was just a general one about criteria. Just, are there any particular entry criteria for people joining the program? I know, Kamal, you've gone over the types of people this is appropriate for, but I'm not aware of any other specific criteria about joining, because this is essentially an open enrollment program as far as I'm aware.
Thanks, Sam. That's correct. There isn't any. We have a very open policy because people will look at programs like this and see it in different ways, and we want to try and make a very open door to people thinking about how the program might serve them best, which is why we encourage having discussions with Sean and I. If you're interested in the program, we're happy to talk to you one-on-one and to sort of pick out the elements that really will work for you. So all we ask actually is to kind of explore a little bit from you in advance as how the leadership program might work best for you, and why now, why you think about a leadership program now. And beyond that, no, there's no other strict criteria for joining.
Great. Okay, thank you very much for that. Just as a reminder, if anyone else did have any other questions, we are sort of coming towards the end of our time now, but I've got one more. Actually, this is one for me as well, which is a bit of not a curveball question, but just a topical question for you both, which I hope you don't mind me popping in. It was, as I mentioned at the top of the session, about the current pandemic. I was just interested to know if you had considered there to be, there's multi dimensions to leadership, of course, but is there, if there was one aspect you would focus on in terms of leadership that needs to be exhibited by potentially our political leaders, I suppose, at this time in the pandemic. What would that key aspect be that you think that the key attribute of a leader which should be focused on at this time of pandemic?
Do you want me to start with that one?
Please, yeah.
Okay, yeah. I think for me there are two key elements at this point after 17 weeks as we are today of COVID in the United Kingdom, and the two key points are: one, clarity. You have to understand what you want to get across to people. You have to be clear about people, and taking a more global understanding of where we're up to, particularly with COVID. You've got to control the narrative. What is it that you want to say to people? You cannot put multiple questions out to people or multiple different dialogues out to people. They have to be simple. People have to understand them. And that's really one of the key parts of leadership is having a clear goal, a clear message, controlling that narrative, keeping it as simple as possible. So literally, if it's three things, which is what the United Kingdom did in lockdown: clear, control the narrative, clarity. After that, I think many leaders have started to send so many different messages that really the narrative now is confused. Lots of people don't know what to do. So it's really difficult without clarity and controlling the narrative. They would be my two at the present time.
Yeah, no, that's a tough answer to follow. So, but I would probably extend that by saying I want to see more emotional intelligence in our leaders. So not just it's great to say we're following the science as using that sort of persistent narrative, but I'd like them to use more emotional intelligence, and by that specifically, I'd like them to think more about empathy and being able to really connect with their followers. We as people who live in a country or any country with political leaders are effectively followers. How are our political leaders connecting with their followers? What sort of level of empathy are they showing? Because there are challenges at multiple in multiple ways at multiple levels as well. How are our leaders reaching out and connecting? And you can see in the past, not just through a pandemic, but you can see political leaders who may be the most powerful people in a country, but boy, do they find a way of connecting to individuals. Somehow they find it, and they have that sort of that magic, that spark of good leadership. And even though you might never meet them face to face, you just feel that connection. So that's one thing I'd encourage our political leaders to do, thinking, how are you making a connection? What skills and attributes are you applying to try and do that? Because then you'll get more people following you and actually trusting you in what you say.
Brilliant. Thank you very much. Sorry for throwing that more macro question in there at the end, but it's very interesting, and certainly I think it sort of speaks to the type of areas that you've been concentrating on in the last few months, talking about leadership as we've seen it emerging. I think when this program started in development, obviously it's before the pandemic, and during the last few months we've seen that carry on. As I mentioned, we are certainly observing an awful lot in terms of the challenges to leaders at the smaller scale and larger scale. And with that in mind, actually, as I mentioned before, I hope everyone can see on screen, there are options to follow us either via the new leadership archive, which we have on the website for the Centre for Evidence-Based Medicine. We have our LinkedIn page, which you can join and follow. We also have our Twitter account. It's actually two Twitter accounts as well. There's also at CEBM as well, but you will see updates from the Evidence-Based Healthcare Twitter feed there. And also, if you'd like to email us, I mean, this email address, cpdhealth@conted.ox.ac.uk, is the one you should use to pursue your interest in the programme, to contact us. I think Sean Kamal always mentioned that they're happy to reach out in LinkedIn if you'd like to go that way and to be in touch and talk about the programme and also the wider issues. So really, I just wanted to say thank you very much again to Kamal and Sean for your time today and your presentation. It's been very enlightening, and I know that we are looking to run some continued sessions in the next few weeks and months, where no doubt we will add to the dialogue and the information which we've already gained today. So thank you very much, both of you.
Thanks, Sam.
Thank you, Sam.
No problem. Yes, just goes really for me just to wrap things up, to let you know, March 2021 is the beginning, the first module of the programme, and then we're moving to module 2, module 3. Module 2 Module 3 in the summer of 2022. Full details on the website, but please do email us if you have any questions. And stay in touch. We will be in touch with more updates to come, as mentioned. And I think we're wrapping up just about on time after 35 minutes. So please, everyone, enjoy your days and take care. Thank you very much, everyone, for today. And goodbye from Oxfordshire.